My name is Mukhtar Ahmed. I'm a colorectal surgeon based at the University Hospitals Dorset. I work between Poole and Bournemouth. The LumenEye is a very simple concept, but it's made a significant difference. It's converted the traditional rigid proctoscope, which depended on bending down to look through with just the naked eye a long tube, often very unprepared bowel in an uncomfortable position, craning your neck, to a high definition camera, which goes in through a tube but gives you a high definition view with the ability to capture pictures and to do videos, but also the possibility of a proctor looking at what you're doing from a distance. So it's really added a lot of value to quite a simple old concept. I think it's, there's no real comparison. The LumenEye is miles better than a traditional proctoscope in that you get, high definition magnified view that allows you to potentially take biopsies under vision, because it's got a biopsy channel, which you couldn't do with a traditional rigid proctoscope. It also, as I said, gives you the ability to capture images and to do videos and to log those and actually prepare a report, where traditionally, with a traditional rigid proctoscope, you wouldn't have the ability to actually produce a report similar to traditional endoscopy reports. So I think it lends itself to doing one-stop clinics, for example, for rectal bleeding, because you have the ability to produce a report instantly and rule out common lesions lower down in the rectum. The LumenEye and the software, the chip, allows us to be able to document what we've done. So there's a cohort of patients who are low risk for cancer that present with rectal bleeding, particularly younger people, where you could have a one-stop clinic where you examine them, potentially send them some simple preparation like suppositories so that the views are good. And in those low-risk patients, you can discharge the patient straight away on the same day without the need to refer them for formal endoscopy. And even if there's a need to refer them for formal endoscopy, you have the ability to have ruled out the common lesions very low down in the rectum, which are the commonest causes of exit-type rectal bleeding. I would say it's really easy to use. It's no different to using a rigid proctoscope. It just adds value to it, and it reduces the need to crane your neck down in a very uncomfortable position next to the patient's buttocks. It's more dignifying for the patient because you haven't got your head down, in a very private part of their body. It allows the patient to also see what you're doing, because you've got the screen. You can position the screen in front of the patient so you can talk to them about what you're doing. You can show them any findings on the screen, and that gives them better understanding of any diagnoses. And even if it's normal, it helps to give them reassurance. You can show them what you're looking at and how far you've got. So I think it really, I think anybody who tries it will see the value.